Hello, everyone. I'm Dr. Marty Ross, and this is another Conversations with Marty Ross MD tonight. Conversation where we're going to talk about Lyme disease. I look forward to seeing what you have in store with me with your questions this evening. As you know, none of these webinars are the same because you create them with your questions. For those of you that are coming back here again, welcome back. I'm glad to see a lot of familiar names on my message board, and I'm glad to see you keep getting value, and that's probably why you keep returning. For those of you that are new, welcome here. I'm glad to see some new names and some new faces. If I could see you, I'd say faces. But the way you participate, there's actually a couple of ways. Number one, you could, especially for your new people, you could go bold on your first time here and actually write a question to me. And the way you do that is on the bottom right-hand side of your screen at the bottom, there's a chat box. Use that chat box to write your question. The only thing that I ask that you do is don't hit the enter key until you have your whole question complete. If you try using the enter key to create paragraphs, it sends multiple questions my direction. It sends a separate question each time you do that. The second way you can participate is to pay attention to the questions as I read them or as you read them, because if you're in the live version, you're going to be able to see those questions posted on your screen and then see what responses I give. There's a lot of learning and education I try to do with each one of these questions, and so, sometimes I might get a little long-winded, but I hope always for good reasons, at least. I have to apologize for last week. My computer showed that I connected, and I understand most of you did not get connected in it all, so I apologize for that. I hope that this week is going better. And actually, I'm just looking here real quick to make sure I haven't gotten any messages saying that people are not getting in. It looks like people are getting in here so far, so that's good. And you're hearing me, which is the other thing too. So I am creating a recording of tonight's webinar, and tomorrow morning you'll get an email from me announcing that recording is ready to be watched. I have to do some minor edits on it this evening. The other thing I want to let you know, I've had to reschedule next Thursday's webinar and the Thursday after that. And that is because I've had some other meetings come up that I have to be in. And actually, the second Thursday, I have shoulder surgery I'm getting, so I won't be here. However, I haven't canceled them altogether. I'm just moving them to Wednesday. So when you sign up, you're going to see that the date for next week's webinar is Wednesday, as well as the following webinar will be on a Wednesday also. We'll be doing those at 6 p.m. Central Standard Time. If you have registered for those webinars when they were Thursday webinars, you're still registered, but I will be sending out email notification to everyone on those registered lists to let them know that I had to move it because I had some other obligations that came up, including my shoulder surgery. So there you go. Anyhow, so that is what we're about here. So why don't we go, so in tomorrow morning's webinar, or when you get the email, you'll be able to sign up for the next webinar on Wednesday next week, okay? All right. So without any further ado, and again, I'm just perusing here to make sure no one is saying we've got problems hearing me. Looks like everyone is doing okay. All right, so let's go ahead and get started here. We'll take the first question. All right. Hello, Lee. Let's see. Lately, I suddenly started getting intense migrating nerve pain on right upper and lower jaw. It also radiates into my right eye and right ear. Happens every night once I'm in bed. Not so much during the day. Any insights, please? No pain on left side of the face, but I remember I had a similar but much briefer episode on the left side of the face last year. Please advise. Wow, I don't know why that is happening to you predominantly at nighttime versus the daytime. It does sound like you've got probably inflamed nerves related to tick-borne infections if you have tick-borne infections. I'm assuming if you're here, you have tick-borne infections. So the thing that I usually suggest that people do for acute nerve pain is try to get the inflammation in the nerve down. And again, that could be inflammation from infection, could even be inflammation from toxicity. And so there's a couple, mold toxicity. So there's a couple things you could do. Number one, make sure you're taking adequate amounts of an anti-cytokine. Cytokines are the inflammation chemicals that get made in tick-borne infections and even in mold toxicity that can that are part of that inflammatory process. So what is good to get the cytokines down is curcumin. Curcumin gets inside of white blood cells and blocks the production of cytokines, which will make it, which will help lower those cytokines. All right. And the product I like using for that, I like using a liposomal product. Liposomal means that it is microscopically wrapped in fat. And when it's microscopically wrapped in fat, it increases the absorption of the curcumin. Curcumin is a derivative of turmeric or a component of turmeric. And so either turmeric or curcumin are just not well absorbed. So you need that liposomal variety, microscopically wrapped in fat variety. And the product I like using for that is made by Thorne, and it's called curcumin phytosome. It's a 500 milligram pill. And I usually have people do one pill 3 times a day for acute inflammation. You might even want to try 2 pills 3 times a day on that, okay? Another thing, if nerves are hurting, that means the nerves are injured. One thing that can help repair some of that injury is to be on glutathione. Glutathione is the very powerful antioxidant that's made in every one of our cells. Its role in the cells is to repair injury, to repair oxidative damage and damage that happens, okay? So if you've got a lot of pain, you might even want to take a higher dose of that. The product I like for that also is a liposomal product. Liposomal, again, means it's microscopically wrapped in fat to increase its absorption. The product that's got some really good data showing that wrapping it in fat that way gets good absorption is Research Nutritionals, and their product is called Trifortify. They have a Trifortify orange, a Trifortify watermelon, and I'd probably do a teaspoon twice a day of that, okay? Now, if your pain still stays bad, then you may want to start doing some what I call neuromodulation, or modulating the chemicals in the pathways that transmit neurologic pain. And so there's a receptor in the brain called a GABA receptor. And if we provide some blockade of that receptor, you can get decreased transmission of nerve pain. Prescriptively, the ways to do that would be to use things like gabapentin, which is also known as neurontin anti-seizure medicine, Lyrica. But from an herbal standpoint, you could use something called L-theanine. Theanine is a component of green tea, and it is turned into GABA in the brain. And if you give more GABA to a GABA receptor, that actually helps control the pain, okay? So, and the way to use L-theanine, it comes as a 100 milligram pill. You can dose it up to 1,200 milligrams a day. And I usually have people start at 1 pill 3 times a day. Keep in mind, if you start getting at higher doses, it might make you a little bit sleepy. An alternative would be to primarily use it just at nighttime, in which case you could even do 200 to 400 milligrams at bedtime, if that seems to be the time when this is acting up for you. Okay? All right. Good luck. And obviously, talk to your physician about this too. You may have some inflammation of the nerves in this area. There may even be related a little bit of the joint in that area. I want to talk to your doctors and have them look at you and examine you for that. Okay? All right. Good luck to you. Actually, let me just do a quick screen share here. Bear with me here, man. I didn't get something set up all the way correctly here. There we go. Okay. Let me go back here again and get that going. All right. So I'm going to do a quick screen share here. All right. So, what I want to show you here is my store. This is Marty Ross MD Supplements. As many of you know, this is, I carry supplements here that I used with my patients in my Seattle practice. These are products that I curate, if you will, trying to find supplements that have really good quality ingredients and have the greatest chance of working for you. Okay. There's been a lot of studies done out there of products you pull off the shelf at GNC and Target and places like that. There's just a lot of garbage. So if you're going to try supplements, make sure you're using good brands, and I've tried to curate that for you. Okay. So anyone can buy from here. I pay for your shipping if your total sales are over $50. And I cover your taxes. You don't have to pay taxes if you purchase from me either, okay? So in terms of showing you these products that I wanted to show you, so there is, in terms of the curcumin, the product that I like using again is this Thorne curcumin phytosome, okay? And then in terms of the glutathione, the products I like are these Trifortibrite products that are showing up down here as well too. Okay, all right. All right. Hello, Cesar. Let's see. Hi, Dr. Ross. My 14-year-old daughter is treating for Bartonella for 5 months. Doxy, diflucan, cinnamon clove, and oregano, many supplements. She's had no symptoms for 2 months, and we will stop the antibiotics now. 2 questions. 1, since she started the treatment, she's been feeling like bladder is not empty after urinating, and that bothers her a lot. No pain. Is that a common Bartonella symptom or side effect of medication supplements? Her bladder is fine as she just did a pelvic CAT scan. 2, I will keep her on probiotics for a year. I'm really confused about what is the most efficient for her case, as there are many different formulations and different bacterias. Today she takes a half teaspoon of VSL number 3 once a day. I think it works really fine as she goes to the restroom more frequently and healthier than before starting the antibiotic treatment. She was more constipated and her feces were really hard before starting the antibiotics. Should I change it or add another variation to recover her gut? All right. So let's start with your first part of your question. So when somebody has Bartonella, there is a possibility that some of the bladder symptoms are due to Bartonella. Bartonella can lead to inflammation of the bladder lining, but usually that's going to give people an urge that they have to pee frequently, and even sometimes bladder pain, and even sometimes I feel like burning on urination. It's almost like urinary tract infection type pain. Okay, so it's possible that maybe this is a symptom of the Bartonella. However, if all of her other Bartonella symptoms are pretty much resolved, then the likelihood that this is a Bartonella symptom that just is hanging on probably is not so. Okay, so the other possibility is you've got a side effect from something she's taking, and I agree with you on that, but I'm not clear what it would be. To be honest, I'm not, of what you've listed here, I don't usually see a bladder irritation as part of that. The one thing that sometimes people do is Methylene Blue, which is a compounded antibiotic you can use for growing and persister Lyme and Bartonella. And that sometimes gives bladder irritation, but you don't list that here as a possibility. Of the doxy and the diflucan, cinnamon clove, oregano, I don't see those as giving bladder pain usually. Okay, all right. Then, in terms of my recommendations when somebody stops their antibiotics, either herbal or prescriptions, is we have to keep in mind that having been on antibiotics, a person's going to remain a risk for getting too many yeast in their intestines, and that can go on for a long time. All right. So what I try to do in my treatments is to try to rebuild a good bacteria balance in the intestines after treatment. And I do that by using supplements for herbal probiotic supplements. I'm sorry, not herbal, but probiotic supplements for at least a year. And for the first 6 months of that, I like to have people on something that is herbal or prescriptive way of swatting down yeast to keep them from popping up. So the non-herbal way of swatting down yeast would be to use something called nystatin, usually a couple pills twice a day on that. Or you could use a combination of a product I like is something called Capri Plus by Karuna. Karuna is Karuna, and Capri Plus is CAPRIPLUS. It's a combination product that's got some garlic, oregano in it, and also some caprylic acid. That's why it's called Capri Plus. Anyhow, a couple of pills twice a day on that would be usually a good dose, okay? But after 6 months, you would stop that. But throughout that whole time, be on a good probiotic. And my choice, so first of all, your VSL is good, and often that can be covered by insurance. Insurance sometimes will cover that. It is it is a human type strain probiotic, meaning it's made up of bacteria that normally live in your intestines, okay? In the world of probiotics, though, many of us are going more broadly than that these days. We like using products that have human strains in them, but we also like using products that have what are known as spore-forming strains in them too. So spore formers are strains of bacteria that come from the soil, and those spore-forming probiotics probably don't take a foothold in your intestines the way the human strains do, but they support your healthy bacteria in your intestines to work better, and they seem to support the human strains that you take to get a better foothold as well too. Okay, so the product that I like for that is a combination product that has both human strains and and spore-forming probiotics, is a product made by Research Nutritionals, which is called Multibiome. MULTI-BIOME, multibiome, and that is 1 to 2 pills 1 time a day. It's pretty strong. You usually can get by with just one, but if you really want to do a good job of trying to rebuild the bacteria, you would do 2 pills 1 time a day. All right, so that's generally what I do with my patients. Okay, all right. Good luck to you, and good luck to your daughter. Let's see. Bear with me a minute, everyone. I got a light here that is just flickering and it's driving me nuts. Hopefully that'll stop. All right. Hello, Lars. Let's see. Let's post your question here. Hi, Dr. Ross. Thanks so much for communicating your rich knowledge in such a constructive and clear way. You're welcome. I enjoy doing it, and I hope you're getting some benefit too. As I begun to watch, I have the impression this could change the Lyme picture in important ways. I was exposed with bullseye rash, then classic knee arthritis, swelling bursa, stiff neck, and other symptoms before any treatment at all. Then 10 months of tetracycline lifted the wider range of these symptoms so that I wasn't treated until 5 years later when my weakening immune system brought symptoms back. The next treatment was 3 antibiotics and a pulse schedule together with itraconazole and a nasal spray included a biofilm buster. After the first week of treatment, I developed shortness of breath, 80 beats per minute heart rate, and a mild fever. I stopped and resumed in a while. But then after a week trying again, I developed sepsis or something like it and spent time in the emergency room. My question is whether you've seen sepsis-like symptoms during treatment and how you might advise proceeding. No, I have not seen somebody get septic in treatment. So I don't have a history of how to proceed with that. And although you've done a good job detailing here, I would need to know a little bit more. When you say septic, did they find any blood or bacteria growing in your blood? I would need to ask you a lot more about your symptoms as well, too. So I'm sorry, I'm not going to be able to give you a quick answer on this. I apologize for that. All right. Good luck to you, Lars. Hello, Denise. Hi, Dr. Ross. I finished my treatment for Bartonella and my psychiatric symptoms are gone. That's great. Good, good. You know, I know you've got more question here, but one of the things about Bartonella is it really can lead to psychiatric symptoms, the whole host of them: anxiety, depression, hallucinations sometimes, a range of psychiatric symptoms. So I'm glad to hear that. I still suffer some days of brain fog and some anxiety. especially during my menstruation. Is there a supplement that helps with that? And is there a relationship with menstruation and an increase of cytokines that provokes that? So women that are still menstruating do tend to have a decline of their symptom or worsening of their symptoms around their period. And it has to do something with the hormonal influence and how your nerves work, but also the hormonal influences and how the immune system works as well too. Okay. The one thing though, that if you're still having one thing you want to make sure is when you say that all of your Bartonella is gone, the question I would have, and I think you should look at with your physician is it? That's a hard one to figure out sometimes too, okay? So symptoms that make one wonder about Bartonella are neuropsych symptoms, so the psychiatric ones we already talked about, but you're getting some anxiety still, and so that would make me wonder, is it really done? Another symptom of Bartonella can be brain fog, okay? So cognitive issues, thinking issues as well too. Other symptoms that can sometimes suggest that Bartonella is still there is a pain on the soles of the feet, especially in the morning. Sometimes tremors or shakes. Sometimes having some air hunger, feeling like you can get enough air from time to time. So I can't ask you a lot of questions to help figure out, is there clinical Bartonella still here? But you may want to review that again with your provider, because that could be one of the reasons you're still having symptoms. Could be, okay? The other thing, though, that can sometimes happen when you have having had infection is that you can sometimes be left with some injury to the nervous system from having had that infection. And there's a couple things you can do to repair that injury. There's a few things you could do. One would be to use a combination of glutathione and a group of what are called phospholipids, or fats that make up the covering of your nerve membranes and make up the covering of your energy factories called mitochondria. Okay. So a way to rebuild the nervous system that's been injured, which could be leading some of your anxiety and leading to some of the brain fog, is to take that glutathione, that liposomal glutathione, the triforta product that I mentioned earlier, about a teaspoon a day. That helps repair injury to the nerves and your mitochondria from the inside, okay? And then to fix the membranes of the nerves and your cell energy factories called mitochondria, working with a product called ATP 360, which is made up of the phospholipids that make up the fat membrane of that is your nerve cell membrane, and also your mitochondria membrane. Mitochondria, everyone, there's about 300 to 400 mitochondria per cell. That's your power plants. That's what gives your cells energy to heal, okay? And whenever you have ongoing infection, there's an overproduction of oxidizing agents in the body. Those oxidation agents can damage fatty membranes, meaning your mitochondria membrane, as well as your nerve cell membranes, and that can result in ongoing symptoms. But you can fix that. And that ATP 360, taking 3 pills one time a day, by 2 months, you'll start to know if it is helping you. And if it is helping you, then I usually have people take it for a total of 6 months. Okay, so those are some things to think about. So review again with your provider whether you might have Bartonella still there, but you can then also do some of the repair work that I just mentioned here. Okay, now there's another thing that I'm using to help repair nerve injury these days, and even muscle and joint injuries, which is an additional way you could approach this. I'd probably approach it first with the glutathione and the ATP 360, but let's say within a couple months you're not getting major benefit there. Then you might look at adding in a peptide called BPC 157. So let me talk about peptides real quick. Peptides earlier this year were quite the rage, and I think a lot of people have tried them. Some people got benefit, some didn't, but this is still one that can give good benefit. So what peptides are, there's over 100 peptides that have been classified in our body. These are substances we make in our bodies. And there's a distinction between what we call a peptide and what we call a protein. All right. So both peptides and proteins, the building blocks are amino acids. And if you put enough amino acids together, if you put more than 40 amino acids together, we call that a protein. If there's less than 40 or 40 amino acids and less, then we call that a peptide. Okay, so it's just a matter of how many pieces of amino acids you put together. All right. Now, in our bodies, again, there's been over 100 different peptides that have been identified, and there's one that's made in the stomach lining called BPC 157. And BPC 157 has been used, the main reason the stomach makes it is to help repair gut injury and keep the intestines working well downstream. All right. But athletes discovered long ago that it's great at repairing injuries, sports-related injuries, so joint and tendon and muscle injuries. And in the world of Lyme, our observations are it helps muscle, tendon, and joint injuries, and it helps with neurologic repair as well too. Studies show that it can help with mitochondria function. I mentioned that earlier. And so that's another option for you to consider as well too. When I'm using it for that, I'm usually going to do one pill twice a day, and I want to give it at least 2 to 3 months to see if it's going to work. Now, if you want to do the full court press, you could do the glutathione I mentioned, the ATP 360 that I mentioned, and the BPC 157. You can do them all. You can do them all at the same time if you want to. Okay. All right. So I hope that gives you some useful information. And again, I would go back and talk to your provider, make sure that you guys really do think that Bartonella is gone. It may be. I just can't quite tell from the brief synopsis that I get here. Okay. All right. I do a quick screen share here. Show you a couple things to take a look at. All right. So at my store, the products that I was just mentioning, if you're looking for the BPC 157, just literally write it in, BPC 157. And we got a couple products, although one of them is out, this BPC 157 spray, but the pills, we do have that. So that's where those are. In terms of the products to repair your mitochondria and nerve cell membrane, take a look at this ATP 360. And that's this product here. And then earlier, I already showed you the glutathione, okay? And then in my Lyme information site, you can take a look at an article that I've written about doing, well, actually, let's take a look at the one called Energy and Fatigue. And take a look at this article called How to Fix Mitochondria and Get Better Energy in Lyme Disease. The steps that I mentioned here to fix mitochondria also are the ones that are going to fix nerve cell injury and the mitochondria injury as well too. Okay, so take a look at that article as well. All right. Well, looks like so far everyone looks like it's working. The webinar is working tonight. I haven't had no one's writing complaints, so that's good. I'm glad you all can hear me, and I can get your questions. Good luck to you, Denise. Hello, Andrea. Let's see. Hi, Dr. Ross. I've been dealing with Lyme, Bart, and Babesia for a number of years. Also have mold, and I've been treating it for a little while. But every time I take any type of binder, I feel 100 times worse, especially Welchol and charcoal. Why is this happening? Is it mobilizing too many toxins? I'm just confused since I thought binders would help with the HERG symptoms. My next question is related to mast cell activation syndrome, also called MCAS, everyone. Why do my MCAS symptoms get so much worse when I'm treating with antibiotics? especially amoxicillin? How can I help control the mast cells? I already take quercetin, Pepcid, and Claritin. Sometimes it gets so severe, I feel like I need to go to the emergency. It's just so hard to treat when my body is so overreactive. Any suggestions? Thank you. All right. So both parts of your questions tie together. Okay, so I'll just start by saying that. So there is a group of people that we treat that I call sensitive patients. All right. And in people that have a lot of sensitivity, there's a few things that sometimes are present. One can be mast cell activation syndrome, like you mentioned here. Okay, so everyone, the allergy cells in our bodies are called mast cells. Mast cells are where histamines are made. And historically, we always thought that they only got turned on when a pollen or a cat dander or something like that landed on them. All right. What we now know, though, is that infections and toxicity can stimulate the mast cells to make too many histamines and release them more easily too. All right. So sometimes, as a result of having chronic infection, people's mast cells get turned on. All right. Now, I don't know why. Oh, and when they do get turned on, so those mast cells turned on not only make a lot of histamines that give a runny nose, give fatigue, give headaches. They also dump out a lot of cytokines. And I mentioned cytokines briefly earlier, but cytokines are chemicals also made by white blood cells when they see infections or they see a toxin. And when the white blood cells see those, they manufacture these cytokines. Cytokines are good and bad. If the immune system is getting rid of something, and the cytokines are made to help the immune system work better, okay? But if the immune system is having a hard time getting rid of toxins or getting rid of Lyme, it's going to manufacture too many cytokines. And too many cytokines give you brain fog, give you fatigue, make you hurt all over, make your hormones not work, etc. Okay. So now, if you have your mast cells are turned on, they're also dumping out cytokines. You're just swimming in a lot of cytokines. And it makes it hard to move because if you start killing things, it's going to trigger more cytokines on top of all these excess cytokines you have already. Okay, for instance. All right. Now, comments about pulling your mold toxins out, that gets tricky too. So whenever you bind a mold toxin in your intestines, which keeps it from getting reabsorbed back into your bloodstream, that causes a deficit, a shortage of mold toxins temporarily in your bloodstream, okay? And the way that the body likes to maintain balance, you probably have all heard the word called homeostasis, right? So if toxins don't reabsorb back into the bloodstream, then other toxins that are stored in your tissues move into the bloodstream. Some of those would even be mold toxins. And that act of moving toxins into your bloodstream triggers more cytokines. All right. Okay. All right. So that's another concept. All right. So actually detoxing triggers more cytokines, which could be why you're feeling so badly. Okay. All right. Now, the first step that I always like to look at when somebody has super sensitivity like you do is I want to make sure that they don't have too many yeast living in the intestines, all right? The reason I want to do that is too many yeast living in the intestines also overly stimulate your mast cells, all right? They also lead to excessive cytokines. And generally, they're one of the more easy problems to reverse. And if you can reverse it, you can treat those yeast, then you can start going after your other infections and your mold as well too. So the way to figure out if you have too many yeast, there's a questionnaire I have, and I'll show you where that is. And if you score a wonder, you have too many yeast. What I do in my patients that super sometimes I'll just stop the mold to their infections, and I will just go after yeast slowly. I might start with really, really low doses of my anti-yeast treatments to build into that, okay? All right. The other thing that leads to super sensitivity in people sometimes is having Bartonella infections, all right? So your risk factors of being sensitive can be too many yeast, mast cell activation, and having Bartonella, all right? All right, I'm going to show you an article that I've written here in a minute that talks about where do you start? How do you deal with all this? Okay. But the key concept is on anything you give to address the problems, you have to go low and slow. All right. And the first infection, the first situation I would address is yeast going low and slow. And while you do that, then there are a few things you need to do. You need to try to lock down your cytokine production as much as you can. All right. Now, right now, the quercetin that you're taking to help stabilize your mast cells so they don't make any histamines, those also help lock down some of your cytokine production. All right. Make sure you've maximized your dose of your quercetin. I would try to be on at least 500 milligrams 3 times a day. All right. And out of that, you're getting some help on cytokines. You're getting some stabilization of your mast cells. All right. I would also add in some curcumin. I mentioned that earlier tonight. I would look at a curcumin phytosome, and I would probably do 500 milligrams of that, 1 pill 3 times a day. All right. All right. So at a minimum, I would be doing that. Okay. And then in terms of yeast, I would definitely, if you have it, then you need to start getting on probiotics if you're not on those already. And then given how sensitive you are, you may want to go with an herbal yeast killer and start with really low in terms of how you're going to do that. Okay. All right. All right. And then in terms of mast cell activation syndrome. So again, the steps to dealing with mast cell activation, you're doing a number of them, but one thing that you want, so the one thing I want to let you know is the number one driver of your mast cells, the things that really turns them on the most that you can affect is stress and anxiety. And sometimes if you can just help balance out the emotional state and the stress state of life, that can make a big difference, okay? So that could be doing things like meditation. It could be dealing with the problems that are giving you stress. Whatever it is, you got to deal with stress. It could be getting counseling. It could be meditation. It could be quitting your job if you can. That's giving you stress. Whatever it is that's dealing with stress, you've got to calm that stress down. Okay. All right. Other things that can help deal with your stress reactivity in the body involve doing things that can retrain a part of your body called the limbic system. And that's your area that deals with flight or fight and reproduction. And so you may have heard of some of these methods before, but meditation can help. There's a system called the Gupta method, and there's something called Hopper dynamic neural retraining system. Those are all ways to calm that agitated, super reactive, stressed limbic system. Okay, so those are some things to think about as well too. All right. Secondly, I would go on a low histamine diet. I would look at trying to pull histamines out. Third, stabilize your mast cells. You're doing that with the quercetin. That's good. 4, you want to try to block your histamines once they get released. And you are doing that with the Claritin, and you are doing that with Pepcid. Sometimes people find better benefit adding in something called ketoprofen that might help with that as well too. Okay. And then the last thing you want to do is remove anything from your environment that you might be allergic to that is stimulating all of this. Okay. All right. So I know that's a lot of stuff. You need to keep working with your physician on this stuff all as well too. Okay. And then finally, one way to go low and slow when you start dealing with your mold toxins. Woo! We haven't had rain forever in Austin, Texas, and suddenly the last 2 days we're getting it, and we are really getting it. We're getting we need it too, so I'm glad to hear it. But you may be hearing a lot of that rain in the background. I feel like I'm in an echo chamber here. I hope you can hear me still. But anyhow, when somebody is really sensitive in terms of doing germ killers and binders, you need to go really low and slow. So when I go to germ killers in a sensitive person, I'm often going to do herbal tinctures. And the reason is I can microdose, all right? So instead of taking a 500 milligram Biaxin pill, where you can't microdose that, you can, you can use your herbal antibiotics and start with 1 drop, or you could start with a 1/4 drop. The way you do a 1/4 drop is you just take a drop, put it in 4 ounces of water and take an ounce. There's a quarter drop, for instance, okay? And then with binders, when I got somebody that's really sensitive to binding, I like using something called pectin powder. Pectin comes from apples and comes from citrus, and it is, you can literally just dip your finger in it and take a small amount that way. Or you can take 1/8 of a teaspoon, or you can take a 1/4 teaspoon instead of taking a full scoop. But you can do, that's one way of getting at microscopic dosing as well too, okay? All right. So I've talked about a lot of things. Obviously, you need a good doctor involved helping you here, but those are some things to consider. Look for yeast, make sure it's not there. If it is, go after that first. Stop treating everything else first, okay? Maximize your stabilization of your mast cells by dealing with stress. Even if you have to add in an anti-hopper program and a Gupta method to deal with that stress or get counseling, stop your job, whatever it is that's giving you stress, deal with that, okay? When it comes time to deal with your medications, go for microscopic dosing of your herbal antibiotics and even your binders when you get to go back into those again as well too. That would be my approach, okay? All right, let me show you some articles about this. All right, so take a look in my latest article section here. And about, I think 2 or 3 weeks ago, I released this article called Action Guide, Medicine Hyperreactivity and Sensitivity, okay? And in here, I said, identify the causes. And I said, yeast overgrowth, mast cell activation, Bartonella, pore detoxification, and a hyperactive limbic system, okay? All right. And then in terms of how to deal with that limbic system, I did mention this to you earlier, but there is something called the Gupta program and anti-hopper dynamic neuroretraining system, okay? Take a look at either of those. You can Google those and find those, okay? All right. And then when I talk about going low and slow here as well too, right? For more information about mast cell activation syndrome, for those of you that are new to the whole concept, take a look in my immune system and take a look at this article called Mast Cell Activation Syndrome and Lyme, okay? All right, Andrea, good luck to you. You're in a tough situation, but I hope those give you some ideas to consider at least, okay? All right. Hello, Jason. Let's see. I've used your combined protocol, clarithromycin, fluconazole, and melurone, for 6 months with very good improvement, but do not want to stop treating at this point. So first of all, great. I'm glad that everyone, that's a combination. The clarithromycin with melurone is a Babesia treatment, and the clarithromycin with fluconazole is a good treatment for growing and persister Bartonella. The clarithromycin fluconazole also is good for growing Lyme. It doesn't necessarily do anything for persister Lyme, but I just want to let you know that, okay? All right. Fluconazole, let me just say something about that real quickly too. So many of you know fluconazole as being an anti-yeast agent, and you're probably thinking, well, what the heck does that have to do with Bartonella? Well, they're in our quest to try to find what we can give people to kill persisters. There's been a lot of research going on, all right? So briefly, a persister is a hibernating form of Lyme or of Bartonella. We don't think there's persister Babesia, but what happens is we give antibiotics long enough, sometimes the germs will go into a hibernation state. And in those hibernating states, they tend to ignore standard antibiotics that we use against them, all right? Now, probably based on lab experiments, it's a very small percentage of germs that go into these hibernating states, but it could be what keeps people from getting well. About 4 or 5 years ago, Johns Hopkins University and some of its laboratory studies looking at what it could give people to deal with Bartonella persisters did an experiment where they took an antibiotic or an antimicrobial from most major classes. So for instance, they did tetracyclines by using doxycycline. They did the azoles, which includes flagyl, which is metronidazole, fluconazole. They did that by using a drug called clotrimazole, which is a cream usually used in vaginal and skin yeast and fungal creams. Okay, it's not made in a pill form, no. And in their experiments, they showed that clotrimazole was actually quite active. Now, at the time, I didn't use clotrimazole because I was thinking, well, that's not available in a pill form. I can't use it. But about a year and a half ago, I started using it in my treatments in Seattle and found that great results. I mean, really good results treating Bartonella. And it coincides with a number of my other colleagues started doing it around that time too, but I didn't even know they were all doing it. I think we all stumbled on it at about the same time. But yeah, it could be a good treatment. And because fluconazole is an azole, some of the azoles are good at treating one of the appearances of Lyme, which is called the cyst form. So terminology again, the Lyme germ actually has 3 appearances, and those 3 different ways it appears can be growing and can be persisting. Okay, so there's a spirochete, that's the corkscrew looking thing. There is a form of Lyme that moves inside of cells. We call that the L form. And then there's a microscopic cyst form, that's a cyst. Okay, and the cyst, the intracellular Lyme and spirochete Lyme can be growing and can be persisting. Okay, azoles like metronidazole, we have some evidence they're good at cyst, and therefore fluconazole, which is usually yeast medicine, also is likely good against the cyst form of Lyme as well too. Okay, all right. Now I know that I told you I can get long-winded explaining things here, but anyhow, let's get to your question here. What is a good protocol for relapse prevention for Lyme, Bart, and Babesia? I'd like to start Methylene Blue, but is it okay to take well on 10 milligrams of Lexapro? I was thinking of 100 milligrams Doxy 1 time a day, Malarone 1 time a day, and Methylene Blue 50 milligrams 2 times a day. Thank your protocols in your time. All right. So the question is, do you need to be on anything to prevent relapse? All right. So I want to be clear. It's very possible you can use antibiotics, get well, and wipe all these germs out. I know that may sound kind of far-fetched, especially if you've been really sick, but it's very possible you can wipe all of these germs out and never have to deal with an issue of relapse. So generally in my treatments, what I like to do is if somebody hasn't been treated before, they come to me and they're sick, my goal is to get them well. And if I get somebody well and symptom-free for at least a couple months, then I will stop all antibiotics. And I will not put people on preventive regimens because it's very possible we wipe all those germs out, okay? And then I'll wait and see. Now, I admit there is the risk of relapse, okay, if the germs are still in you. And so what I'll do is if somebody does get into a relapse, then the next time around, after I get them well again, then I'm going to want to put them on something to prevent a recurrence from happening, okay? All right. But I will admit, I think a lot of people we can treat once and we're done. That is a big possibility. And you're not subject to years of antibiotics for no reason at all. Because keep in mind, those antibiotics that you may be taking to prevent a relapse, you may not need them, number one, but they're also disturbing your gut microbiome. And again, the gut microbiome is very important. It regulates our immune system, regulates our thinking, balances out our neuropsychiatric situation. Anyhow, the gut microbiome is responsible for huge stuff. Now, granted, when somebody has active Lyme, active Bartonella, active Babesia, we got to knock those germs down, and we risk the injury that we do to the gut. But we don't just want to be putting people on things to damage the gut because they might get back sick with Lyme and Bartonella. We want to have good reasons to do it, okay? Now, if you do relapse once, then we know that maybe you're not a person we're going to be able to wipe this thing out in. And at that point, you may want to go back on things, okay? Second point, I won't let you know that may sound scary, but generally in my practice, when people have relapsed, we're usually talking about 4 months to get them back on their way to a good place again. Most people that relapse, it is not going back into the treatment hole all over again. Okay. So I just want to let you know that piece of information as well, too. Okay. All right. Now, if I am going to try to use antibiotics to prevent relapse, generally I will use about half dose on my prescription or half dose on my herbal antibiotics. So 100 milligrams of doxy one time a day is half a normal dose. We usually do 100 milligrams twice a day. So that sounds reasonable. Methylene Blue, which you're proposing to use here, it may have some anti-Babesia properties, can kill growing and persister Lyme and Bartonella. And at 50 milligrams twice a day is a full dose. All right. So you would be using that one a full dose. Now, would it prevent relapse? Maybe. And is it less harmful to the gut? Yeah, than prescription antibiotics. Okay. Now, the reason everyone that Jason's asking about whether he can take it with Lexapro is Lexapro raises serotonin, and methylene blue has an effect called an MAO inhibitor effect, which can raise serotonin as well too. And we get concerned about having people on too many things that raise serotonin, which could lead to something called serotonergic syndrome or excess serotonin. Okay. Now, some of my colleagues will never use methylene blue when somebody is on an SSRI like Lexapro or on Wellbutrin. Okay, they won't do it. I'm not quite as strict as that. I will use my SSRIs like a Lexapro at maybe up to half maximum dose and still use my methylene blue. And I've never run into problems with that. Okay. But you should talk to your doctors about that and see how they feel comfortable about that too. Okay. So this is a situation where I'm not your doctor. I'm saying how I do it, but you need to make sure that they're comfortable with that as well too. All right. But generally, yeah, I think so. Lexapro, you can dose all the way up to 20 milligrams. So you're about half dose there. And I have used it in a similar way with methylene blue 50 milligrams twice a day and not had any problems with my patients before. Okay. All right. Good luck, Jason, and thanks for that question. A quick screen share here. So everyone, methylene blue is really an interesting drug. It's something that was originally designed to help people, or is approved to help treat people with a condition called methemoglobinemia. And what happens in methemoglobinemia is, here we go. What happens in methemoglobinemia is people that have this problem, their hemoglobin, which is the protein in the middle of blood cells, doesn't release oxygen easily, especially when they get under stress. Okay, and so methylene blue, we give in a crisis, we give it IV to bump the oxygen off of their hemoglobin. But we've discovered that it has these effects of helping with Lyme and Bartonella and maybe Babesia as well too. Okay, all right, so this is my article about it. If you want to read a little bit more about the ins and outs of methylene blue, what you can combine it with in terms of helping with persisters, and the warning that I have in here. I hope I have it in here about oh, that's right. So I talk about the risk factors of the SSRIs in the video. You've got to listen to the whole video about that. Okay. All right. There you go. All right. So there you go. That gives you some more information to look at. All right. Good luck to you. Hello, Andrea. Let's see. I've had severe neck pain since a tick bite in 2019. I was diagnosed with positive Lyme, Bartonella, and Babesia tests. What one of these infections causes the extreme tightness and soreness down the spine and back of the skull? It's interesting. We tend to think of neck pain, especially neck pain that's associated with cracking and popping, being more of a Borrelia Lyme issue. Okay. But the way that this is, you're describing it, soreness down the spine, going down, sounds more neurologic to me. And so maybe there is a Bartonella component there too. I would, to give the best answer, I need to examine you, to be quite honest with you, and ask you a little bit more questions about the nature of that. But those are two thoughts for you. Okay. All right. Good luck to you. Hello, Sean. Let's see. What time is first morning urine, if per a lot, i.e., 5 or 7 a.m.? It depends on what the testing is. So, I think you may have asked this question last week when we all didn't connect, even though I spent an hour, almost an hour, answering everyone's questions, even though you all couldn't see me and I couldn't see you. But anyhow, I think your question was that you wake up about every 2 hours, or somebody asked that question last week, that they wake up about every 2 hours in the middle of the night. And so they're trying to figure out, how do they determine what the first time of the day urine test is? And what my response was, it would depend on what you're testing for. The idea when people say that they want to do a first urine in the morning is they want chemicals to build up in your urine when you're not peeing overnight, so they have the greatest chance of finding it. Okay. But because you pee so much, you're not going to have the benefit of that first time in the morning. And my thought would be is to go whatever is the longest period you can go without peeing. That's when you want to do it. Now, I'm not sure what the test is they're doing, and I might change that. So if they're doing it as a means of measuring what are known as your endorphin-like chemicals, or your metanephrines and catecholamines and chemicals like that, well, then I would probably say as long the last time it is before you get out of bed, okay? But if it's a mold toxin study, I don't think it's going to matter. So it depends on what they're testing you for as well, too. Okay. I would talk that over with your doctor. They should be able to give you some guidance on that. All right. Good luck to you. Hello, Deb. Let's see. For Lyme, Bartonella, Babesia, a family member is taking cryptolepis and BLT. Is it smart to add Psittacuta, Houttenia, or Cemento? How long to treat? Also, another family member, a child that was scratched by a cat several months ago, is now showing symptoms similar to what I read for Bartonella. What is best to start with at this age and at age 13? What should we test for from a cat scratch? All right. So cat scratches transmit a strain of Bartonella called Bartonella henselae. Okay. Ticks transmit other Bartonella henselae and other strains, but cats, what they transmit is Bartonella henselae. And that is something that can be tested for with pretty good certainty through regular labs. So if there is a concern of your child being sick after a cat scratch, your regular doctor should be able to do an antibody test through a regular lab for Bartonella henselae and then treat based on that. That would be my thinking, at least. Okay. And that's mainly if they got it from that cat scratch. All right. In terms of agents that you can use for cat scratch type of Bartonella, azithromycin, Zithromax is good. And usually in that type of a situation, you don't need to be on two different antibiotics. Usually one, like an azithromycin, is enough. But again, you should talk to your doctor about that to see if they agree with that too. Okay. All right. All right. And then in terms of cryptolepis and BLT, so you mentioned, should they take it, should you add Psittacuta, Houttenia, and Cemento? So Cemento is cat's claw. And Houttenia, which is useful for growing and persister Lyme. Houttenia is useful for Bartonella. And Psittacuta is useful for Lyme and Bartonella. And they're primarily targeting growing Lyme and Bartonella. The Houttenia is targeting growing Lyme. All right. Cryptolepis is an herb that is useful for Babesia, growing, and persister Bartonella. All right. Now, the BLT that you're on is a formula from Research Nutritionals that I believe has Houtenea in it. I believe it has cat's claw in it. And to see if it has Acida acuta in it too. So let's go look at that together here. All right, so let me just pull it up here. Very interesting. All right, so when I said it's interesting, it's showing that it's a list price crossed out, and then it still has the same list price. So I'm not sure what my system is doing. I'll have to go back and look at that. Anyhow, let's look and see what the ingredients are here. So it's got some red root, some sarsaparilla. It's got bone set, teas. Oh, I was wrong about this one. All right, so this formula BLT with its bone set and its bone set makes it good for Bartonella. Okay, killing Bartonella. Red root helps increase blood flow to improve blood flow, and that can be helpful in Bartonella as well too. The black walnut that's in here is useful for Bartonella and for Lyme, but I would not call this a heavy Lyme formula. Okay, so I have to say that. This might be a very well, the teasel in here can help with Lyme though too, but I wouldn't call it a heavy Lyme. I would call this a heavier formula oriented at Bartonella. Okay, so let's go back here to your question. All right, so in terms of the formula, so crypto is good for Lyme and Bartonella and Babesia. BLT is predominantly more of a Bartonella formula. So between crypto and what is in the BLT, you've got good coverage for Bartonella. Okay, so therefore, I don't think you need the Houtenea and the Acida acuta. All right. On the Lyme side, I would say that BLT is a little bit weaker though. And I might look at adding in a cat's claw. Cemento is the Nutrimetics brand's cat's claw. It's quite expensive actually, but you could get other cat's claws. So for instance, the cat's claw product I carry by Montana Pharmacy is almost half the price of what you're paying for that Nutrimetics formula, and their formula is no more effective than just regular old cat's claw. So you might look at that. Okay, but cat's claw is good because it also treats growing and persister Lyme. So just looking at this and briefly what you've written here, and I don't know enough absolutely what's going on symptom wise, but I think it would be enough to do a crypto, a BLT, and add cat's claw in, and not add in Acida and a Houtenea. Okay, just based on what you've written here. All right. All right. Good luck to you, Deb. Hello, Robert. Yeah, Dr. Ross. I've been taking cinnamon, clove, oregano capsules along with Japanese knotweed as my antimicrobials for 12 months or so. I've gotten benefit, but felt that I have plateaued with it. I was taking one pill a day, so I switched to Cryptolepis taking okay, let's see. I was taking one pill a day. So I switched to Cryptolepis using a half teaspoon 3 times a day. Herxing was very strong, but I stuck with it about a week. I stopped for a day and felt the Cryptolepis will help a lot. I started again with a quarter teaspoon, but it quickly became too much. So I was back down to 5 drop doses, increasing by a drop a day. I got to 17 drop doses, then had to cut back to 15. Otherwise, I'd be in bed almost all the day with fatigue. I don't know why I got so sensitive so fast, especially fatigue. I've been checked for macrocytic anemia and I'm not iron deficient. Last webinar, you discussed hypothyroidism, and all I know is that my regularly tested items are at the low end of the ranges. I'll be printing out your excellent white paper for my PC to get data on all thyroid. Let's see here. On all thyroid values, do you think the thyroid could be affected by sensitive cryptolepis as well as the cinnamon clove oregano capsules? Okay. So one thing so yes, thyroid I don't think is going to be involved in your sensitivity, but low thyroid could be involved in your overall fatigue. Okay. All right. Then I want to clarify. So from what the way you just asked that, I think you're still taking your cinnamon clove oregano, and then you recently added in, and you're still on the Japanese knotweed, and then on top of that, you added in the cryptolepis. Okay. So you may just be having a lot of killing going on. Now, why is it that you suddenly are not able to handle as much of the cryptolepis? I'm not sure. I'm not sure. I would wonder, given that you could tolerate more at a point and now you can't tolerate as much, what I'm thinking is, what else is triggering excess cytokines in you that's making it so that when you kill germs and that causes cytokine release, that you're already in a cytokine pool that can't handle the addition as much? And the one thing that can sometimes worsen as you're treating that would lead to more cytokines the longer you treat is too many yeast in your intestines. So I don't get to ask you a bunch of questions here, but if I could, I would be wanting to ask you questions to figure out, have you developed too many yeast? And is that why you're becoming more sensitive to killing Lyme? Because killing Lyme leads to more cytokines, right? Because of a Herx reaction. And if you've got yeast in your intestines, trigger your white blood cells to make too many cytokines. And as yeast grow more and more, you get more and more cytokines. Is that what's going on here? Okay. All right. So again, I mentioned earlier tonight, everyone, that the reason you have symptoms we call Lyme symptoms are because your white blood cells overproduce cytokines. All right. When you kill germs, that causes your white blood cells to release more cytokines in response to the germ killing. When they see the germ parts, they make more cytokines. And if your yeast start growing too much in your intestines, as they grow more and more, they're going to trigger more and more excess cytokines, increasing your swimming pool of cytokines. Okay. All right. So if your swimming pool of cytokines continues to grow because you have too many yeast, there's not as much room that you have to add more cytokines as part of killing your reaction before you start feeling badly. Okay. That's what my point is there. All right. So symptoms to look at that could indicate that you might have too many yeast include increased sugar cravings, feeling a lot worse after you have sugar, intestinal gasiness and bloating. Sometimes too many yeast in your intestines leads to, will release toxins. Those toxins go to your skin where they interact, and then they lead to more pimples and acne and even skin rashes like eczema, for instance. Okay. So just look at those and see, did you say yes? Did you answer yes to a lot of those questions? If you did, you might have a yeast problem that's kind of popped in here. Okay. All right. Good luck to you, Robert. Hello, Alan. Hi, Dr. Ross. What do you suggest for resistant yeast? I've been following your protocol for yeast for months, suspended herbal antibiotics during this time, 2 months with fluconazole and nystatin combo plus probiotics you sell. Initially got good results, then backslid after attempting to eat fruit. Then did 1 month on itraconazole and nystatin with probiotics. Now I'm nearing the end of a month, 2 on the compounded, let's see. Now I'm nearing the end of month 2 on the compounded pill form of amphotericin B plus probiotics, and I feel I've made little progress. My diet has been similar to the Mito food plan for 20 years. No processed food in that time, no sweats, no gluten. 3 years ago, after taking Malarone, I could no longer tolerate fruit. I've not been able to successfully add in any fruit, including avocado, tomato, nor legumes while on yeast protocols. I'm afraid this is a result of having been on prednisone many times over 2 decades to treat now that I realize I was MCAS caused by yeast overgrowth. All right, wait to see. I think there's a second part to this question, Ellen. Well, I am not seeing a second part to this. So I want to let you know, in terms of yeast, I would I would want to spend time questioning you to make sure that I agree that you have symptoms suggesting too many yeast. Okay, I always do that every time that I visit with people and I'm treating yeast. If they're not getting better, I'm always going back and re-asking all those yeast questions again to make sure it's not too many yeast. Okay, so if you are not improving after a good protocol like this, there is something else you might want to consider looking for, and that is called small intestine bacteria overgrowth. All right. So your intestines, small intestines, are not supposed to have many bacteria in there. And at times they do get too many bacteria in there. And then they ferment food, leading to gasiness and bloating. All right. So I might consider looking for that, especially if you're not getting better on this kind of regimen. There is a breath test that you can do where you take a sugar called lactulose, you swallow that, and then over the course of 2 hours or 3 hours, depending on how you do it. 2 hours if you have regular bowel movements. If you have constipation, you want to do it over 3 hours. You're going to breathe into tubes and collect your breath. And then those tubes are going to be sent off to the lab and they're going to measure how much hydrogen and how much methane you're producing. All right. And if you produce too much hydrogen or too much methane, we call that SIBO. That's how you diagnose SIBO. Okay. And so I might consider doing a breath test. Now I got to tell you, to do that breath test, you're going to have to come off of your antibiotics and your antibiotics and your antimicrobials and your anti-yeast medications as well too. All right. Now, if you do look for SIBO and it's not there, then you want to continue thinking about how do you treat yeast. And sometimes the one thing I want to say is amphotericin, as I have mentioned, and you know, it. I tend to look at it as my go-to drug if all other things are failing with a yeast treatment. Then my go-to drug is this medication called amphotericin. Amphotericin, everyone, has to be compounded. It's made for people that have yeast living in their bloodstream, and it only is manufactured intravenous form. The reason it's not made in a pill form is that it's not absorbed into the bloodstream. So, and the manufacturers and those that approved it don't agree you can have too many yeast living in the intestine. So they didn't realize that it would be great for treating intestinal yeast because it doesn't get absorbed. All right. Now, if you read about amphotericin B, you're going to just see some horrid side effects. And that is only when you do it intravenous. When you actually do amphotericin B in a pill form, it's not absorbed enough that you're going to get into systemic side effects or systemic toxicity. Okay. In other words, it's either not absorbed at all or minimally absorbed, I guess is what I would say on that. Okay. All right. Now, let's say that you don't have SIBO and you're still continuing to have yeast. Sometimes you have to use amphotericin B for even longer than 2 months. And in situations like this, I'm going to want to start looking at possibly adding in garlic, if you can tolerate it. One, I usually do have people take a crushed clove. This is going to sound bad, but crush a clove of garlic, put it in water, and then drink your crushed clove. Okay. It's a way of getting it down. The act of crushing a clove of raw garlic releases a chemical called allicin or activates it. And it can be quite an effective killer of yeast in the intestines. Okay. But that might be a next step to consider doing then too. Okay. All right. But Ellen, I would go back and make sure that this is yeast. I might reconsider by looking at doing this SIBO test. Okay. All right. Let me just do a quick screen share and show you my article on SIBO. So look at my stomach and intestines chapter. Somewhere here. Here it is. So this is the article, small intestine bacteria overgrowth, okay? The other chapter you might want to look at too that talks about other things to do when you've got a lot of intestinal dysfunction like that is this article called Intestinal Dysfunction Symptoms Test and Treatments, okay? So I would look at both of these articles together. Good luck to you, Alan. Hello, Joyce. Let's see. Thank you for sharing your extensive knowledge and of an oftentimes baffling illness. Wish you were still seeing patients now that you're in Austin. For those of us with long-term, over 20-year Lyme co-infections, that will probably be with us forever and is well managed most of the time. Please suggest the best course of action when there is a flare-up of symptoms, usually due to stress, lack of sleep, flamming issues, etc. I'm currently taking Sida acuta, Hutania, cat's claw, otoba bark, Japanese knotweed, and cryptolepis. In addition of my regular vitamins and minerals, I take glutathione every morning and curcumin 2 times per day. Would you suggest also taking Cytoquel? Also, is it necessary to take cat's claw and otoba bark if taking Japanese knotweed and cryptolepis? I've been on CC and OB for 2 years. I've been trying to reach the doctor in California just 2 weeks ago. Thank you for anything that would help. All right. So, Joyce, one thing I would look at, I'm afraid I don't have a great solution, but I have more of a long-term solution for you, okay? So there is a group of people that stressors will lead to a flare in their symptoms, okay? And the way to step back is to try to retrain a part of your brain called the limbic system so that it is less reactive and less inclined to lead to, which doing that will make it so you're less inclined to develop worsening symptoms under stressful situations, all right? So the limbic system is a part of the brain I mentioned earlier tonight that is in charge of reproduction, it's in charge of our fight or flight response. And as a result of having chronic infections, it sometimes can get locked into an on position that then leads to your symptoms. Or when it does get triggered to being reactive, it leads to symptoms. All right. So you can work with that. And I think I showed you the Gupta method and the system of Annie Hopper earlier. There's also something called a brain tap program that sometimes can be helpful. But learning ways to make it so that you're not being reactive under these stressful situations is probably the better long-term solution, all right? So that's what I would steer you towards looking at. Yes, when things flare, you could add in a Cytoquel, but probably before doing that, I would probably take your curcumin and I would increase that to 2 pills 3 times a day. And that would be how you're going to get your maximum, so 1,000 milligrams 3 times a day total. And that's going to be how you're going to maximize blocking cytokines, okay? Yeah, those are my comments for you, okay? So take a look at, do a screen share here. So there is an article I've written about what to do when you're just never going to get all the way well, or treatment hasn't worked all the way, okay? And that's this article called "Why Chronic Lyme Treatment Fails: A Review of Strategies." All right. And one of the ideas, again, is that you have ongoing problems due to this part of your brain called the limbic system that just becomes overly reactive and overly turned on. And if you look here, you can see I got a link to the Gupta program. the anti-hopper dynamic neural retraining system, but also the brain tap program is another option to look at as well too. Okay. All right. Good luck to you, Joyce. Thanks for that question. Hello, Chris. Hello, Dr. Ross. Sorry to ask my questions from last week since we couldn't listen to the answers. It's true. Is it possible, and have you seen Lyme Bart Babs trigger hypoglycemic episodes in non-diabetic patients? Can any of the herbal treatments, Otoba, Bart, cat's claw, Utinia, Psittacuta, Japanese cryptolepis? 2, with Bartonella, have you seen patients recover from neurologic side effects, including headaches and dizziness, or might we have to manage those for the rest of our lives? 3, if we've been diagnosed as suffered vestibular nerve inflammation damage, is there anything that might first stabilize and then regenerate those cellular pathways? Thanks for the valuable information you share with us. You're welcome. And I did answer this question last week. Let me see what I said. Let me see if I can remember. Anyhow, I am not aware that Lyme and Bartonella and Babesia directly trigger hypoglycemia, nor am I aware that have I seen cat's claw, these herbs that you're on trigger it too. Okay. However, one thing that sometimes happens in chronic Lyme disease is that you get adrenal dysfunction. And if you have adrenal dysfunction, low adrenal function can lead to hypoglycemia. Not having enough production of cortisol by your adrenal glands can lead to hypoglycemia symptoms. Okay. And so, one thing you may want to consider adding in here is an herbal compound called ashwagandha that is an Ayurvedic and Chinese medicine herb that has been used for thousands of years because it's been known to give good energy. Animal studies suggest better adrenal function. Okay, and so I would start with that. It's ashwagandha. It's a 400 to 500 milligram pill, 2 pills in the morning and 2 pills between 1 and 2, and see if that can help with that. If that doesn't work well enough, then you may want to look at even adding in some ground up adrenal gland. You can find that in a thorn product called Cortrex, which has a ground up adrenal cortex, the covering of the adrenal glands, and the center of the adrenal glands as well too. Okay, so that's one thing to consider. Okay, in terms of neurologic side effects, yes, it is possible that when you treat Bartonella, just killing all your Bartonella germs will be enough to make it so you're never going to have problems with those again. In other words, you could heal completely from that. But let's say you get to a point that all of your other Bartonella symptoms are gone and all that you're left with is the neurologic injury symptoms. Then it's time to start thinking about doing some repair work. Okay. And so the way that you can do that type of repair is I would look at doing that BPC 157 peptide that I mentioned earlier tonight that can help with both neurologic and tissue injury in general, can help heal. And I would look at trying to do 1 pill at least twice a day with that. Okay. The other things that I would do to help repair injured nerves are glutathione, which helps repair injury from the inside. And I would probably do, if you still have significant symptoms, I'd look at doing 1 teaspoon once a day or even 1 teaspoon twice a day. And that's the Trifortipride product by Research Nutritional. Okay. And then finally, I would look at adding in and doing the phospholipid membrane repair that I mentioned earlier tonight, the nerve cell membrane and also your mitochondria membrane. And I would do that ATP 360 product that I mentioned. And I would do 3 pills 1 time a day. Okay. So yeah. I mean, if most of your other symptoms of Bartonella are resolved and this is what's left, and there is that possibility of injury. Okay. And the way you repair injury is the BPC 157, the ATP 360, and the glutathione too. Okay. All right. One last thing to think of that I don't think I mentioned last week when you couldn't hear it is so you probably have heard of hyperbaric oxygen before. So some people in the world of Lyme have used that for germ killing. It's probably not that effective as a germ killer. But the one thing there is that there is a concept known as neuroplasticity, where injured nerves can heal and reconnect with non-injured by reconnecting to non-injured nerves. Okay. And what is useful at doing that is hyperbaric oxygen. So if you do a BPC 157 and if you do an ATP 360 and glutathione, let's say you do that for 2 to 4 months and you get nowhere, then you might want to consider looking at hyperbaric oxygen. All right. But talk to your physician about that and see what they have to say about that as well, too. Okay. All right. Good luck to you, Chris. Hello, Sonia. See, I was diagnosed with Epstein-Barr virus again. That was the co-infection I had with Lyme. My naturopath tried me in 2 antivirals. I got bad side effects from both. I can't recall what you had prescribed for me when you first diagnosed me. Can you tell me what you recommend for Epstein-Barr? Okay. So just quickly. So Epstein-Barr is tricky. So the thing about Epstein-Barr is a chronic virus. It's the monovirus, but in many people, it is a virus that we cohabitate with. And in fact, and the way that most doctors try to see if you might have Epstein-Barr activity is they measure to see whether your immune system is making antibodies against it. And if they see that you're making high antibodies, they sometimes think that that means you have too much Epstein-Barr, all right? But that isn't necessarily so. So for instance, if you pull 100 healthy people off the street and you measure their antibodies against Epstein-Barr, you'll find about 10 or 20% that have elevated antibodies against Epstein-Barr. And these are healthy people. Sometimes elevated antibodies don't mean your immune system is trying to put a germ back under control. It just may mean your immune system is working to control a germ and cohabitate with it. All right. I want you to be aware of that. All right. So just seeing elevated antibodies of antibodies for Epstein-Barr does not mean the germ is active. All right. Now, you have some track record that says that when you did treat for elevated antibodies before, in you, that meant that you did get better. All right. And so if you're going to treat for Epstein-Barr, I like to do a few things. Number one, I like to boost the antiviral part of the immune system. And I like to use a type of mushroom to do that called reishi mushrooms. And the product I like is a product made by Mushroom Sciences. It's called reishi gano. And it's a 400 milligram pill. And I would have a person do 1 pill 3 times a day. The next thing I would do is I would get on an herbal virus killer. And what I like using for Epstein-Barr is olive leaf extract, 500 milligrams. And have a person start at 500 milligrams 3 times a day. After they're done herxing on that, then I might go up to 1,000 milligrams 3 times a day. And after they're done herxing on that, then I might go up to 1,500 milligrams 3 times a day. And I'd do that for about 6 months, okay? So that would be my treatment. There's another agent that I would have people go on, but no one's manufacturing it anymore. And that was to be on something called thymic protein A. It was a product called ProBoost, but the manufacturer has stopped producing that product, okay? So at a minimum, I would do the reishi gano 400 milligrams 3 times a day, and I would try to work up to 1,500 milligrams 3 times a day of olive leaf extract, okay? All right. Now, Sonia, if you go to my website right now, the Thorn product is gone. They've stopped manufacturing it. I would take a look at the olive leaf product by Biocide and Botanicals called Olivirix. And I believe that's a 500 milligram pill, and you could use that as a substitute. Okay. Keep an eye out. In about a week, I will have another olive leaf extract product. Is made by Karuna that I'm going to be using as more of my substitute for the Thorn product. But in the meantime, you could do that Olivirix product by Biocide and Botanicals. Okay. All right. And good luck to you, Sonia. All right, everyone. That's it. It's 7:30 here my time, and I've got 2 Basinjis that are snoring, but I need to get them out, otherwise they're going to drive me nuts later on tonight. It's been good being here with you tonight. Again, if you signed up for Thursday's webinar next week, you are still signed up for Wednesday's webinar, because as I announced earlier tonight, I'm moving the Thursday webinar to Wednesday next week. I've had a scheduling conflict. Also, the week after, so in 2 Thursdays, I am not doing that webinar because I have a outpatient shoulder surgery that day. And so we'll be doing that webinar on Wednesday. So our next 2 webinars are going to be on Wednesdays. Okay. So I just want everyone to be aware of that. And if you had signed up, you're still signed up. All right. And keep your eye out on your email from tomorrow morning. You'll get an email from me in the morning announcing that the recording is ready to be reviewed from tonight. All right. Great to see you everyone tonight. Good luck, and we'll see you next week. Bye-bye.